We're going to talk about something that most people don't want to talk about, but as nurses, it's something that we have to deal with. We understand that not all pregnancies result in a happy bouncing baby boy or baby girl. And sometimes our job as the nurse is to help the family through this loss. I want you to think for a minute, which one of these do you think is the worst? There isn't a right or a wrong answer here. For you, some of these might be worse than something else, and that's okay. But if you honestly feel that one of these is worse than the other, one of these isn't really a loss, so I don't understand how people could be upset about this, then I just want you to think about that is what your bias is. What you feel is worse may not be what our family thinks is worse. And so we need to find them where they're at and care for them where they're at. What type of perinatal losses do we have? We have the ectopic pregnancy that we've talked about, fetal death, miscarriage, stillbirth, death after birth, either from prematurity and the complications that go along with that, congenital abnormalities, or genetic defects. Characteristics of a perinatal loss is that it's completely unexpected most of the time. And even if we know that there was a congenital anomaly prior to birth, our parents hope against hope that this doesn't mean that their child's not going to survive. It's not an ongoing thing. If we're talking about they've known through most of their pregnancy, it means that for 9 months or less, they knew this was going to happen. And that's very difficult to deal with when pregnancy is supposed to be a happy experience. In the case of our miscarriage or early pregnancy losses, this is a loss that others may not recognize. Well, it wasn't like you were pregnant that far. You were only 6 weeks along. It's not like you got to know this little one because you didn't even get to meet him. You were 6 weeks along. That was 6 months ago. You need to get over it. And so others don't recognize that the grief is still there and the grief is ongoing. What is our care management? We have to help our parents and the family members actualize the loss. If we walk in the room and act like nothing happened, that's the biggest injustice we can do for our families. We have to acknowledge this child. We have to acknowledge what happened. We need to help our parents with decision making. If one thing is common in grief, whether it's grief surrounding our newborns or grief around our loved ones, it's that there's this sudden chaos in the loved one's environment, and they don't know how to move forward. They don't know what they're supposed to do next. Sometimes our job is to help them know what to do next. All right, we need to call the funeral home. Are there family members that you need to call? Would you like me to help call them? We cannot take over. We cannot make those decisions for them, but we can help guide and direct. Help the bereaved acknowledge and express their feelings. If they want to scream and cry, then let them scream and cry. I have heard people say, well, you need to be quiet, don't be so loud. You're going to scare the other moms on the floor. Why are they more important than what this family's going through? Normalize grief process and facilitate positive coping. And there's a lot of ways that we can do this as nurses. Offer to let the family see this child, to hold this child. That helps actualize that this was a real person. This helps actualize that something went terribly, terribly wrong. You have to be able to say hello before you can say goodbye. And there's a book by that. It's out of date and it's not being published anymore, but it's one of the best books that I've ever seen on perinatal loss. When your parent dies, you lose your past, but when your child dies, you lose your future. And I remember my mom saying all the time when, a child was lost in a car accident or drowned at the swimming pool, I can remember my mom saying, you're just not supposed to bury your children. That's just not the way things are supposed to be. I don't know how parents do that. Grief is normal and painful, and that it's a process. There's no one thing that signals that it's over. There's no certain steps they have to go through to get there. It's a process. You can be 10 steps forward and 5 steps back in this process. Mourning is the process by which they reorganize and adapt. Grief is the emotion that dominates that process. It's hard to realize that things are never going to be like they were. When our moms lose a child, whether it's through miscarriage, stillbirth, they never go back to being a non mom. They were pregnant. If you've never been pregnant, then you can say that you don't have any children. What are these parents supposed to say? They can't deny that they had a child, but do they want to explain right now where their child is? Our parents need to have the whole process validated. That yes, they were pregnant, and yes, they've lost this child. We have to help them recognize that something was wrong. And in the case of a miscarriage, we may not be able to understand what went wrong. And of course, they have this concern about the ability to produce a normal, healthy pregnancy in the future. And that gets very concerning when we talk about things like an ectopic pregnancy. If we've ruptured that tube, then that tube is removed. So part of her fertility has been removed. And can she get pregnant with only one tube? Yes, she can. But it's very concerning. What if this was a loss because of a congenital anomaly? The concerns are, is that going to happen again in the next pregnancy? We need to give parents as much control as possible. That includes pictures. It means that we need to offer to take their cell phone and go take pictures. Say the baby's in the ICU. Take their cell phone and go up and take pictures of their child. We used to, before we had cell phones and we had Instamatic cameras or we had digital cameras, we could take pictures and give the parents the pictures to look at later. Or we would take a roll of film of like 12 pictures and give them the film and say, when you're ready, here are pictures of your child. And certainly if they've named this child, then please use the child's name. These are pictures of Johnny that I took for you. When you're ready, you can get these developed. Don't ask them about the pictures. Certainly we have to ask them if we're going to take their cell phone and go take pictures. But these are not medical pictures. These are keepsake pictures, so we don't have to sign papers. If you ask them and they get scared about that and they say no, then it puts us in a quandary. Because what we do know about grieving parents are that those who actually saw their child after their child had died, say their child died in childbirth or because of a congenital anomaly, what the parents visualize their child is going to look like, it tends to be much worse than what their child actually looked like. And so actually seeing pictures of this child, actually being able to hold this baby, it validates that this pregnancy was real. It validates that this child was real. They get to say hello, so they get to say goodbye. Keepsake, such as a snip of baby's hair, footprints, handprints. Some places have little plaster of Paris, little tins that they can do the footprints in. So they have a cast of footprints in their hands. Maybe the blanket that they were wrapped in, or the little cap that we put on their head. Let them be a parent. I've helped parents bathe their newborn and then dress them in the clothes that they brought to the hospital with them to either take baby home or to have their pictures done in. And there's something about that process of being a parent that allows them to say hello and allows them to say goodbye. We allow them to keep baby at the bedside for a while after delivery. And there does come a point when we have to say, okay, it's time. We need to take baby now. And that's very hard for our parents. But we also know what happens to our bodies when they're at room temperature. There's not blood flow. And we want to spare our parents that. The parents that I helped, like with the bath, and they wanted to do that, they were afraid. And so I helped them get started. And I slowly kind of moved out as they became more comfortable seeing and holding and touching and talking to their newborn, to where I was just there as a support person. I wasn't there doing much. And that support can never be undervalued. Some of our babies do require an autopsy. Why did this happen? What happened? And then what do they want? A lot of our hospitals have a very nice process. Volunteers knit blankets, knit gowns for these babies to wear, and they give these to the parents. We take them out in like a special little basket or something that we might have, depending on the size of this baby, and present this baby. Does this get easier? I can't say that it gets easier, but the more you do this, the more you realize what a value you are to those families in helping them through this process. And while it's sad and it's heartbreaking, it's also rewarding knowing that you assisted them on one of the most difficult days of their life. Allow the parents to parent. Allow them to see and hold this baby. And pretty soon, what's pretty amazing is even in the presence of some big physical anomalies, I've heard parents go, look, he's got your nose, he's got your ears, he's got the, hulapa feet. Whatever it is, they claim this baby the way that parents of a living child claim their child. What are the similarities to the family? What are some of the differences? How do they look like another sibling? We talked about if they say that they don't want to see the baby. A lot of our parents are very afraid to see their baby for the first time, but we do know that it often helps parents to be able to see and hold their baby. Would you like to see your baby? I can stay here with you. Sometimes just knowing that they're not going to be alone is what they need to be able to say, yes, I want to see my baby. What are the right words? There are no right words. All you can do is tell the family, I can't even imagine how hard this would be for you. And I'm sorry, what can I do for you? Don't go in and act like you can change everything and that if you just had the right words, you could make their pain go away. Because that doesn't happen and that's not true. All you can do is be honest with them. Even if you've suffered a pregnancy loss yourself, you can't know how these parents feel. So don't pretend like you can. They may not need to hear your story, but they need to understand that what they're going through are typically normal emotions. I had a case one time. I sat in report and I listened to report, and the off-going shift was very distressed over the husband. This mom had a baby. The baby was very sick at delivery. They immediately shipped them off to a higher level hospital, to a higher level NICU. And once mom came over to the postpartum unit, dad hadn't even been in the room. And they're thinking dad is this horrible person because he hasn't been in the room to talk with the mom. As soon as change of shift report was over, I went and found this dad. And I walked up to him and I said, I heard what happened last night. I'm sure this is very difficult. What can I do to help you? Well, the night shift had kind of shunned him as being just a terrible person. I mean, he had tears in his eyes and he said, this is the second time this has happened. I don't know what I'm supposed to say. I don't know how to go in and talk to her. And all I could do was say, I understand that could be very difficult. Would you like me to go in? Let's go in and go talk to her. He needed help walking in his wife's room because he thought he was supposed to be able to go in there and fix it. So I walked in with him, told her how sorry I was for what had happened. Have you talked to the other hospital? No, they're busy. I haven't heard anything. Well, how about if we call them? Well, no, they're probably really busy. Their job is to take care of your child and to give you updates. Let's call them. And so I helped them call the other hospital. And they found out the baby was actually doing better than they expected. That's what this family needed. They needed help because they didn't know what the right words were and they didn't know what the next steps were. You can't fix it. You can't take their pain away, but we can't run away from it either. When you walk into a patient's room and this has happened, I'm so sorry about what has happened. What can I do for you? What do you need right now? Sometimes asking them what they need may not be a very good question because they have no idea what they need, other than for you to acknowledge that something has happened, something terrible. So acknowledge it, talk about it. So I understand that y'all named your baby Johnny. Yes. Why did you pick that name? Talk to them about that. Don't ask them all the gory details. So what happened? I mean, did this baby's heart just stop in labor? We don't need to ask like that, but we do need to be sensitive to the fact that something's happened and help them with this loss. I always said if I was in nursing long enough to come up with a theory, it would be time to quit. Well, here's my theory, my one and only theory in nursing, the cycle of silence. The caregiver has dis-ease with this situation. The patient is silent and compliant to minimize the caregiver's distress. If the caregiver walks in and kind of tiptoes around everything and I'm going to take your vital signs, I just need to feel your stomach. Okay, I'm done, I'm out of here. Then our patients realize that the caregiver is in distress. And so they, in turn, are silent because they don't want to make the caregiver feel any worse, the nurse feel any worse. And the nurse then interprets their silence as their inability to cope with or discuss the situation. So the nurse leaves, the patient feels isolated and feels guilty. It's just this big silence. So when you walk into a patient's room, acknowledge what happened. Be human enough to talk to them for a few minutes before you march right in to do all your processes, your vital signs, your fundal checks. Acknowledge them, acknowledge what happened. Theory of caring, knowing. Don't go in with a preconceived idea of what the parent knows, fears, feels, or wants to know. Go in and ask them, how are you feeling? And I know when I was a nursing student and I heard my instructor say, ask them how they're feeling, I thought that was the stupidest thing a nursing instructor could ever say. Well, how do you think they're feeling? They just lost their child. The truth is, I don't know how they're feeling. And that's how to open the door and find out where they're at. Being with. There's no perfect words. We've always heard, don't just sit there, do something. In this case, it's don't just do something, sit there. Take time to be with, not standing over them as they're in bed and you're standing up. Go in and take a chair and sit down. I want to know how you're doing. I want to know how you're feeling. Is there anything that I can do for you at the moment? How are they going to call their mother to tell them this happened? Let them verbalize those fears and those feelings. Enabling. Give them the information. Teach them, provide the information, and then allow them to make the decision. We tend to think in our culture that dad should be the strong one and he needs to be making the decision. Or we tend to think that the grandparents should take over and do most of the decision making because the kids in this instance are so heartbroken they can't make them. Those aren't decisions anybody else should be making for this family. The parents need to be making those decisions. Now, if they choose to involve others to help with those decisions, then great. But we shouldn't delegate to the husband, to the grandparents, to the friend, to the sister. Y'all need to go do this so they don't have to. Part of working through the grief process is all those things that have to happen. Calling the funeral home, calling their pastor, and then laying on of ears. We have two ears and one mouth, so maybe we need to listen about twice as much as what we talk. Still a postpartum mom. We're going to talk about postpartum next week. But everything that we teach our postpartum moms, we need to teach our moms who have lost a pregnancy. She's going to have lochia. She's going to have postpartum bleeding. She's going to have to have her fundus massaged. Her milk may come in once she goes home. And if we don't tell her all those things, when does the milk come in? It comes in at like day 3 and 4. If mom's already home and boom, all of a sudden her milk comes in and now she has painful breast, in addition to cramping as her uterus shrinks back down, these are all physical reminders. And she just thinks her body's betrayed her one more time. She deserves pain control and to be taught how to relieve some of her discomforts, ice packs, Motrin. If she needs a Rogam shot, then we need to make sure she gets her Rogam before she goes home. She may be at risk for hemorrhage. We need to teach her all the things that we're going to do because she's postpartum. Fundal massage, maybe getting Pitocin to make that uterus cramp down. She's going to get frequent vital signs. And then the usual routine discharge instructions that we give all moms. We need to let them know that there are going to be some days that are going to be very painful in the future. Whatever that normal expected due date. This is the day baby should have been born and it didn't happen. Or the anniversary of the pregnancy loss or the confirmation of the pregnancy. Holidays. This would have been Johnny's first Christmas. This would have been Johnny's first Halloween or Thanksgiving. Those can be some painful times. We need to let our parents know that. Dad doesn't have to be the strong one. How is that relationship? Who is the strong one? Who is the one that makes all the decisions or most of the decisions? It doesn't need to change because there's been a loss. They need to be taught that they're going to grieve differently. Grandparents will also grieve, but they tend to grieve silently, and we tend not to acknowledge the grandparents grieving. They grieve silently because they don't want to add stress to their children after their children have just lost a child. And so they don't get the support that the couple themselves may get. We need to remind them about some of the stupid things other people are going to say. And they're going to say things in an attempt to be helpful, but they're going to sound really stupid. They're going to be meaningless, but realize they probably said it in an attempt to try to make things better. Forgive them and move on. Things like, at least you can have other children. At least you didn't get to know them. At least they weren't full grown. Not that that makes it better, but somehow people say stupid things. Talk to them about the future and the next pregnancy. Divorce rate increases fourfold when there's been a NICU admission. Part of that is because parents don't know how to talk to each other about the stress that they're feeling. They may both have the exact same feelings, but they don't know how to talk to each other about that kind of stress, about their fears, about their concerns. There's a big financial concern when our kiddos are in NICU. There's a day-to-day, depending on why our baby's in the NICU, there's a day-to-day we don't know if baby's going to survive today or not. And that's very stressful on the family. And typically, we're talking about a new family. Maybe these parents have only been together a year or two, so they really haven't had to figure out how to talk through difficult times yet. What a lot of our research says is that moms grieve the first year and dads grieve the second. The first year for our dads, they're trying to deal with how do they help mom cope. And then the second year is when they get their own time to grieve. One of the stories that I read one time that a dad wrote about his grieving was he was supposed to be the strong one. He felt like he was supposed to be the strong one. The only time that he was allowed to cry was when he was in the shower. And if you think about how our society is set up to socialize our women about baby and baby care and those kind of things. So our moms tend to get a lot of support from their friends, from the family, from their coworkers. What can I do? How can I help? Guys don't always have that exact same support. They don't talk about that pregnancy loss at work like women do. So they don't get that kind of social support. And because they grieve differently, one may grieve very loudly, one may grieve very quietly. They feel like their partner isn't feeling the same thing, and so they get offended. You don't act like you're upset about this at all. I am. I'm just expressing it different. Well, it doesn't look like you're sad. I don't know what you want me to do. It's a very, very difficult time. Burial requirements in the state of Texas, a baby has to be buried if they're greater than 20 weeks, greater than 350 grams, and that equates to 10 to about 12 ounces, or if they have signs of life at birth, meaning if they appear to take one breath, regardless of gestational age, then they're required to be buried. However, parents have the right to bury any child, even younger than 20 weeks, less than 350 grams. And a baby can be buried at the gravesite of a grandparent. Sometimes our siblings are left out in the cold. We don't know what to do with our siblings. So we just won't tell them because they're too young to understand. In this book that I read, one of the siblings said, I had a little sister, but she only lasted one day. We need to be honest with our kiddos. Make it age appropriate, but don't act like something didn't happen. Because the kiddos are going to realize mom and dad are sad about something. And if you're not honest with them, then they're going to be worried that they've done something to upset the parents. And we don't need to cause that kind of stress in our kiddos. We brought baby home and then they took baby away and baby never came back. And they might have been talking about this baby coming for months. And now the kiddos are scared because maybe the baby made mom and dad mad and they took them away and gave them away. We need to be honest with our children. When birth represents death, the nurse is in a vital position to help the family cope with what's going on, regardless of how far along that pregnancy was, regardless of why it happened. We're in a key place to help them through this process. And you can't do that if you don't understand grief, and that grief is hard work. As a new nurse, you may want to run away from these families. While I don't enjoy when we have a child that doesn't survive, I do have great satisfaction at the end of the day when I've worked with these families, knowing that I've helped make a difference. Please don't run away from these families, but be honest. I can't imagine how you feel, and I don't know what to say. How are you? What can I do for you? Being there is as important as any other work you're going to do that day. Assessment of each family member's perception and experience of the loss is very important. What does this mean to mom? What does this mean to dad? Talk to the grandparents if the grandparents are there. Talk to the sister. Talk to the cousins. While we're within our HIPAA constraints, also talk to them because they're grieving too. And realize that culture and religion affect the way that a family is going to respond and cope with perinatal loss. Be there, be present, talk to them. You can make the world of difference at the end of the day. As sad as that is, we still have to talk about it. I realize that for some of y'all, you may have experienced this. And like we said before when we talked about domestic violence, if this has affected you and this is open old wounds, please don't deal with this by yourself. Talk with your clinical instructor, make contact with me. Know there are support services on campus if you need them. But don't let this break your heart and you deal with this on your own if this is open old wounds. That's it for this week. Have a great week.